prostaglandins, and so on. It doesn't occur because the virus is hidden, okay? It's a retrovirus, and in this case is hidden, does not stimulate an inflammatory response, although it causes the injury, if you want, that subsequently is complicated by bacterial infection. Okay, the transmission is similar to caprine arthritis, which occurs through colostrum and milk because the virus resides in macrophages and mononuclear cells in general. And when it comes to adults, is again contact with other animals that are infected. In relation to pathology, there is no gross lesion in Visna except muscle atrophy. However, in the CNS, we can find the same as in caprine arthritis encephalitis, which is a demyelination and softening of the tissue. Yes?
What's Visna? What is Visna?
Okay, so we said Visna is wasting. That's the wasting feature of the disease. Okay, this again is associated with perivascular coughing, as seen here in this picture, necrosis, and eventually malacia, softening of the tissue. The pathology, if we look at the lungs again, they're consolidated. There is a froth in the trachea, an indication of an infection process occurring in the trachea. Hence, the animal has the dyspnea, inability to breathe properly. And this is why they open their mouth. Okay, it can be associated with enlarged bronchial and mediastinal lymph node. Yes?
I'm sorry if you already said this. What's MIDI?
MIDI, it involves the lungs, okay? So that's the consolidation that occurs in the lung. Histologically in MIDI, so the classical inflammation, which is hyperplasia due to fibrous tissue deposition, the mononuclear cell infiltration, interstitial pneumonia, lymphoid nodule surrounding the vessels and airways. So that's really general to most infections in the lung. Indurative mastitis, like in caprine arthritis, encephalitis, the hard udder is also present in this nature. Now, again, similar to caprine arthritis, so we're aiming here mostly for the presence of the antibodies, and we can use tests that detects the antibodies. You can use PCR to look for proviral DNA, and one can do cell culture assays where infected peripheral blood monocytes are mixed with mitogen activated peripheral blood monocytes. Well, basically it activates these cells so that they can acquire the virus from the infected PBMCs, and as a result you can grow the virus in cell culture. Now when it comes to immunity, like immunity to other lentiviruses is difficult to control. The natural transmission, again, as we said, it occurs via colostrum and milk, and the best control is the isolation of animals so they don't contract the disease. What was your earlier question?
The caprine arthritis virus, you said that the kids, once infected with it, they can't get rid of the virus. Is it the same with the does and the bucks too? If they contract it, are they able to get rid of the virus or no?
Yeah, I mean, whichever animal, whichever age, you cannot get rid of retroviruses in general. Okay, the last one, so to give you more time for the exam. This is also a retrovirus, but it's a different genus. This is a genus, the same genus, retrovirus infect cats and caused FELV rather than FIV. So in FELV, the most common, as we know, is the what? What is most common pathology in FELV?
No, that's
Tumors, yeah? Tumors?
Sure.
Okay, so this is a tumor in the lung. As you see it here, it's a tumor of epithelial cells. It's on the surface of the lung. It can go deeper. This is adenocarcinoma or adenoma. This is again another picture of the lung where it shows the presence of carcinoma, adenocarcinoma or adenoma. Now this disease is called ovine pulmonary adenomatosis virus infection or virus disease. The other name is, if I can pronounce it, Yakskietic ski retrovirus. This is Afrikaans name, and what it means when the sheep runs and gets out of breath, they call it Jakskieti. So it's referring again to difficulty in breathing. It's a retrovirus, as we said, that's a beta retrovirus. The disease also called ovine pulmonary carcinoma. It occurs sporadically in the Americas. This way is not a reportable disease, and is associated with chronic wasting and severe respiratory disease. Okay, so the main feature of this is the presence of neoplastic nodules, which are as a result of infection of pneumocytes. It can disseminate through the lung and secrete large amount of fluid, causing the blockage of the airway and difficulty to breathe. If it is complicated by bacterial infection, death can occur.
Did you say monocytes?
Okay, so the incubation period is 1 to 3 years. Again, it's a long incubation period. This is basically the transmission is respiratory. So the initial sign of a respiratory symptoms, the common one, which is the coughing, nasal discharge, etc. The disease is restricted to the lung, and it rarely metastases to the lymph nodes, which is an important, actually, diagnostic feature. Restriction to the lung does not go to the lymph nodes, does not mean it's not present in lymphoid tissue. So the virus can be present in the lymphoid tissue, however, it doesn't seem to form lesions in those tissues. So hence it doesn't metastasis to lymph nodes. So we said it specifically infects monocytes, pneumocytes. It's also found in other immune cells like monocytes, macrophages, and lymphocytes. Okay, so diagnosis: no antibodies are detected against the virus. Why do you think no antibodies are detected?
It's hidden?
okay? The virus is hidden. But it does not have to be hidden. I mean, in this case it is, but it does not have to be hidden. You may induce a very weak immune response. Some viruses can induce a very weak response that is undetectable. But in this case, it is the case. Hence, the main diagnostic test is PCR, looking for proviral DNA in immune cells. The immunity, in this case, because it does not produce, the infection does not produce antibodies, there is little use of a vaccine against this disease. So currently there is no vaccine against it. And isolation of animals is the best thing you can do. Any questions? Well, good luck in the exam.
Thank you.